Hi class, so we're now moving on to chapter 2, research ethics. So let's start off with a brief history of ethical practices in research. So the need to consider ethics in research comes from the result of several experiments that occurred that were unethical. So one of the cases discussed has to do with the Nuremberg Code of 1949. So this was the first international recognized guideline for conducting research in an ethical manner. This was developed as a result of the Nuremberg trial in Germany during World War II. This is where the Nazis medical professionals did a trial on Jewish participants that were in concentration camps. So this code focused on the rights and the welfare of human subjects. It established that participation in research is voluntary, informed consent must be obtained, participants have the right to withdraw at any time, and it is the researcher's responsibility to obtain that consent. The Declaration of Helsinki of 1964 provided guidelines for physicians who were involved in clinical research. It has been revised several times since then. It established the need for researchers to assess risks and benefits of participation. It also emphasized participants' privacy. The National Research Act was passed by the U.S. Congress in 1974. It established the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. It was developed as a result of public outrage over the Tuskegee experiment, where doctors diagnosed many African American males with syphilis. But instead of treating the disease, they merely documented the progression of the disease. So research ethics is a set of guidelines developed by one's profession that state the standards for conducting research with human participants. CSWE Competency 1, which is demonstrate ethical and professional behavior, states that social workers make ethical decisions by applying the standards of NASW Code of Ethics, relevant laws and regulations, models for ethical decision making, ethical conduct of research, and additional codes of ethics as appropriate to context. So in other words, social workers must engage in ethical conduct of research in all stages of the research process. NASW Code of Ethics Evaluation and Research Standards, Section 5.02, outlines the guidelines for conducting program and practice evaluation and research. The report makes a distinction between social work practice and research. Practice refers to interventions designed solely to enhance the well-being of an individual patient or client and that have a reasonable expectation of success. Research designates an activity designed to test a hypothesis. It permits conclusions to be drawn and thereby develop or contribute to generalizable knowledge. Here's an example of research. So a social worker interacting with pregnant adolescent girls notices that many of them have mentioned that they were abused during pregnancy by the father of their child or other relatives. A proposed study on the effects of abuse during pregnancy on maternal attachment would be considered research. The first ethical principle of respect for persons asserts that individuals are autonomous and that they have the right to make decisions for themselves. Researchers must ensure that people who cannot make their own decisions to participate are also protected. The first principle leads to the practice of informed consent. So individuals must be informed of the potential risks and benefits of participating in a study. Information should be presented in a way that all individuals, including special needs persons or institutionalized persons, can comprehend. Individuals must be informed that they will at no point be compelled to participate. The second ethical principle of beneficence refers to the researcher not conducting research that would be harmful to the participants. So harm can include physical or psychological harm. The researcher also needs to maximize the benefits of research for participants, for society, and for the scientific community. Any study should, at a minimum, promote the common good. While the participant may not directly benefit, others in society might, so potential benefit should be explained to participants. The third ethical principle of justice requires that the benefits and burdens of research be distributed equitably through selection of participants. Some groups, such as those with disadvantaged backgrounds or prisoners, should not bear the cost of research, while a different group, such as upper middle class persons, gain the most benefits from a study. Individuals from the marginalized groups should not have their issues ignored by researchers. For example, there is as much of a need for research to be conducted on access to health care for transgender individuals as other gender groups. Informed consent is the process of acquiring the research participants' consent prior to them participating in any research study. So the steps in the informed consent process includes providing information that potential participants need to make an informed decision about the participation in a study, presenting information such that the individual can understand what the research entails, what they may be asked to do, and how the research may affect them, and making sure that the individual is aware that participation is voluntary. There are 8 elements of informed consent form. Statement of purpose of the research, description of risk, including physical and psychological, description of benefits to participants and others, disclosure of appropriate alternative procedures if conducting research on an intervention, available medical treatment options for possible research-related injury, description of how confidentiality will be maintained, information about whom to contact if additional questions come up or in case of research-related injury, and statement that the research is voluntary and that participant has a right to withdraw from the research at any time without penalty. So in some cases, research may be conducted without documentation of informed consent. An IRB may waive the requirement when it is culturally inappropriate to have participants sign forms. Another method of getting informed consent must be used. In the case verbal consent is obtained, there must be documentation. So minors are legally unable to give consent to participate. They can give assent or affirmative agreement. A child's failure to object cannot be considered as assent. So just because a child did not object to being in the study or didn't say no, it cannot be considered as them giving us assent to participate in the study. A parent or guardian must provide written permission. Only an IRB can determine if parental permission can be waived. The third ethical principle of justice requires that the benefits and burdens of research be distributed equitably through selection of participants. Some groups, such as those with disadvantaged backgrounds and prisoners, should not bear the cost of research, while different groups, such as the upper middle class, gain the most benefits from the study. Individuals from marginalized groups should not have their issues ignored by researchers. For example, there is as much of a need for research to be conducted on access of healthcare for transgender individuals as there is for other gender groups. Informed consent is a process of acquiring the research participants' consent prior to their participation in any research study. So the steps in the informed consent process involves 3 things. Providing information that potential participants need to make an informed decision about their participation in the study, presenting information such that the individual can understand what the research entails, what they may be asked to do, and how the research may affect them, and making sure that the individual is aware that participation is voluntary. There are also 8 elements of an informed consent form. Statement of the purpose of the research, description of the risks and benefits, including physical and psychological, description of benefits to participants and others, disclosure of appropriate alternative procedures if conducting an intervention, available medical treatment options for possible research-related injury, description of how confidentiality will be maintained, information about whom to contact for additional questions or in case of research-related injury, and a statement that the research is voluntary and that participant has a right to withdraw from the research at any time without penalty. In some cases, research may be conducted without documentation of informed consent. An IRB may waive the requirement when it is culturally inappropriate to have participants sign forms. When this happens, another method of informed consent must be used. In case verbal consent is obtained, there must be documentation. Minors are legally unable to give informed consent to participate. They can give assent or affirmative agreement. A child's failure to object cannot be considered as assent. So just because a child did not object or did not say no, we cannot just consider that as them giving us permission or them giving us assent to participate in a study. A parent or guardian must provide written permission. Only an IRB can determine if parental permission can be waived. Questions the researcher must ask prior to the study include: do benefits outweigh the risk? Is there an alternative method with a lower risk to participants? Is the study necessary to achieve the goals of research? During the informed consent process, researchers must clearly indicate the amount and the type of risk. Information on whom to contact in case the research-related injury must be provided. Services for research-related stress. Information on where services to deal with related stress can be obtained should be described on the informed consent form, along with who is responsible for providing or paying for those services. Researchers should not be biased in the way that they select participants. In order to do this, avoid selecting from vulnerable groups merely because of easy access or the perception that such groups are easily manipulated. Avoid selecting from advantaged groups merely to make the study result appear to be more effective. Use a criteria to determine who is or who is not eligible to participate. Inclusion criteria is a set of predefined characteristics used to identify participants to be included in a study. Exclusion criteria is a set of predetermined definitions used to identify subjects who will not be included or who will have to withdraw from a research study after being included. Here's an example of applying justice principle. For a study on the effects of abuse during pregnancy on maternal attachment, easy access to pregnant adolescents should not be the primary reason for the study. Select only those adolescent females who experience psychological abuse during pregnancy by the father of their baby. Exclude those who experience any other type of abuse. Researchers must come up with a plan to address the possibility of participants being exposed to an adverse event. Adverse event is harm which occurred to participant that was not planned or anticipated. The plan must specify whether participants will pay for services acquired to address the distress. So researchers must monitor the ongoing research to determine if participants experience an unanticipated adverse event. Researchers must also make decisions on who will have access to the study data, how and where that data will be stored, process for destroying the data, and how to prevent disclosure of participants' personal information. These are some important concepts that you will need to remember when writing up your final project plan. There will be a section, most likely the data collection section, where you will discuss how you will address these things. So who will have access to the data, how and where it will be stored, how are you going to get rid of the data, and how are you going to prevent participants' information to be disclosed. So all universities and entities receiving federal funding must have an IRB. An IRB reviews, approves, disapproves, and requests modifications to all research involving human participants prior to it being conducted. So before you can conduct any research study involving human participants, you must submit an IRB application. The IRB vets all research studies for the protection of the rights and welfare of participants. Even after the research study has been approved, the IRB conducts continuous reviews of the research. It suspends the research in case of adverse events and enforces informed consent and research procedures. So an IRB committee is made up of at least 5 members. Of these 5 members, there should be 1 member that is not affiliated with the university, 1 whose primary concerns are in a scientific area, and 1 whose primary concerns are not in a scientific area. The Revised Common Rule defines research as a systematic investigation designed to develop or contribute to knowledge. It involves obtaining information from living individuals, and it involves an interaction or intervention with individuals. If the IRB determines that the research meets the Revised Common Rule definition, then it considers if the research involving human participants is covered by these regulations. If the research is covered by the regulations, an IRB will determine if the research can be approved for an exemption. This is also referred to as an exempt review. In other words, the IRB is determining if your research can be exempt from a full review by the IRB. Here are studies that can be exempt from a review: educational research, benign behavioral intervention research, secondary research, federal department or agency research, or food quality research. So usually if your research does not involve participants from a vulnerable group and you follow all the guidelines, you would probably just get an exemption. Research that is not exempted from review may be considered for expedited or full board review. So an expedited review applies to proposed research that presents no more than minimal risk to the participants. It meets the criteria for research being reviewed through the expedited procedure, and it has measures in place to ensure that participants experience no more than minimal risk. Minimal risk is defined as the probability and the magnitude of harm or discomfort anticipated in the research are not greater in and of themselves than those ordinarily encountered in daily life. So participants cannot have anything more than minimal risk. So as long as it's something that you would encounter in your daily life, it would be considered minimal risk. So anything outside of what you would encounter during normal daily life would be considered more than minimal risk. So here's the criteria that the IRB uses to determine whether the proposed research will be approved. So they look at the minimal risk, they look at risk compared to benefits, they look at whether your selection is equitable, they're looking for your informed consent, making sure that you're obtaining an informed consent, making sure that you're also documenting your informed consent. You're providing provisions for your data collection and also making sure that you're protecting the participants' privacy and making sure that you have safeguards in place to protect participants from vulnerable populations. So it is the researcher's responsibility to inform IRB of modifications. So it's possible that you start your research study and you have to make changes. If you make any changes after your study has been approved, you must make sure that you inform IRB. So you have to fill out a modification form and submit it to the IRB. You must inform them of any research-related injuries. So if anybody gets hurt during your study, you must also inform IRB about that. So there are consequences if you fail to inform IRB of any changes that may occur after your approval. These can include suspension, inability to publish your results, and even termination of employment. So let's talk about the city certification. So you guys will need to complete this for this class. So there are 2 different trainings that you will complete to get your city certification. If you've conducted research before, it's a possibility that you already have these completed and you can use those certificates for this class. However, if you've never done a research study and you don't have these completed, then these need to be completed before the end of the semester. You should get started right away because it is very long and time consuming. And so you can start and stop and just pick back up where you left off. So you don't have to sit down in one sitting to get it completed. Basically, anyone conducting research, even students, research staff, should go through these trainings. It's basically to ensure the protection of participants. These are all completed online, so you will need to set up an account if you don't already have one, and that's how you'll be able to access the trainings. Once you're done, you get a certificate at the end. Once it's all completed, you'll get a certificate, and those are the certificates you're going to include in your final project plan. All right, I think this brings us to the end of chapter 2.